Good morning. This is Dr. Tarek with some more questions about phlebotomy. Question number 1. If a patient had a right mastectomy 6 months ago, blood may be drawn from the options are left side, left arm, left or right ankle, right arm distal area, left or right arm. The answer is left arm, A. If the laboratory protocol calls for the use of chlorhexidine solution for skin antisepsis, for skin puncture or venipuncture, the antiseptic should not be used on infants younger than 12 months, 6 months, 4 months, 2 months. The answer is D, 2 months. If unable to locate an adequate venipuncture site with a tourniquet applied, how long should the tourniquet be released before reapplying? 30 seconds, 1 minute, 2 minutes, 3 minutes, 2 minutes. Because circulation, once impeded by tourniquet, needs 2 minutes to come to its original position. Which government agency is responsible for laws governing the use of gloves when carrying out a venipuncture? USD, EDA, CDC, OSHA. The answer is D, OSHA. After leaving a patient room, the phlebotomist is asked by the patient brother what test the patient is having. The phlebotomist should provide the information, provide no information, deny having any knowledge, ask the patient's permission to divulge. The answer is B, provide no information. When performing a venipuncture in the antecubital space, the patient grabs the arm and complains of severe shock-like pain. The initial response should be to complete the blood collection, remove the needle and apply pressure, reassure the patient, remove the needle and apply ice. The answer is B, remove the needle and apply pressure. If after leaving a patient's room, the phlebotomist is asked by the patient brother that test the patient is having, what test the patient is having, the phlebotomist should provide information, provide no information, deny having any knowledge, ask the patient permission to divulge. The answer is B, provide no information. The first step in carrying out a venipuncture is to explain the purpose, ask permission, identify the patient, identify the site. The answer is C, identify the patient. That is the first job. A typical blood donor unit contains dash ml of blood. 450 ml, 750 ml, 500 ml, 1000 ml? The answer is A, 450 ml. When performing a venipuncture and a patient with extensive burns, the phlebotomist should pad the tourniquet area, avoid burned area, use a winged infusion set, avoid using a tourniquet. The answer is B, avoid burned area. I read the question again. When performing a venipuncture on a patient with extensive burns, the phlebotomist should avoid the burned area. Which of the following factors is likely to have the greatest effect on the result of a CBC processed within 2 hours of collection of sample? Which of the following factors is likely to have the greatest effect on the result of a CBC processed within 2 hours of collection of sample? Meal time, mild exercise, environmental temperature, dehydration. The answer is D, dehydration. This is all by now. See you next time with some more questions. Please subscribe my channel and like my videos. Have a good day.